The development of this podcast was sponsored by Alexion Pharmaceuticals Incorporated. The viewpoints expressed are those of the person speaking and not of Alexion. Welcome to NMOSD Your Way Global, an educational podcast series for NMOSD patients worldwide. NMOSD stands for Neuromyelitis Optica Spectrum Disorder, a rare relapsing autoimmune disorder of the central nervous system which primarily affects the optic nerves and the spinal cord. Your podcast hosts Lelainia Lloyd and Debbie Latique, who have both lived with NMOSD for over 10 years, will be bringing their respective Canadian and Australian perspectives to the table in order to help patients worldwide better understand NMOSD. Over the next 16 episodes, clinicians, researchers, and fellow patients will come together to have important conversations about how to live your best life within your diagnosis. They will be offering up encouragement and practical tips for overall health and well-being. In this episode, Lelainia talks with neurologist and researcher Dr. Galina Vorobeychik, who is the founder and director of the Fraser Health Multiple Sclerosis Clinic at Burnaby Hospital and a clinical assistant professor of neurology for the Department of Medicine at the University of British Columbia. She was also the recipient of the MS Society's National Award of Merit in 2016. Dr. Vorobeychik shares the importance of a team-based approach to treating NMOSD patients and explains how we as patients can partner with our neurologists to help ensure that we get the best care possible. So, let's get started.
Welcome to the show, Dr. Vorobeychik. So when we're seeing our neurologist, what are the most important things that we should be talking about during our visit?
Well, I think that the most important issue is for first visit or for follow-up visit, we need to know what is important for you. Why patient came to see me? Because sometimes people come and they bring a lot of the questions, including, for example, skin problems. I wouldn't be able to help it. I want to focus on what is important for you and what you think I can address. Definitely, we will touch a little bit of everything. We will touch the issue about the skin. But I think that it's important to provide relevant information in the limited scope of the time, because time is limited for everybody and we cannot spend hours and hours. So for me, it's important that person came prepared. I love when patients do questionnaires before they come. I love if they bring notes, and then it means that the people took time to think about it, and it helps me. And I frequently actually review their notes prior to appointment if it's sent to us. So that is important, especially on the first visit. Now, what about follow-ups? What do I want to know? I want to know what changed. That is the most important things for me. And what become new concerns for you? I definitely want to hear if person will update me about general health, because it could be very important and it could be relevant. It's important for us when we're treating patients because the field of neurology changed. And unless you tell me, I wouldn't know about it. I can give you a very good example. I have a patient who she was doing this ear infection for 3 months before she came for regular follow-up, and just somehow, luckily, she mentioned it to me. Her family physician was treating her. As soon as I heard it, I knew this, that your immune system is way too suppressed. She's immunocompromised. It's unique type of infection. So that was important piece of information that she shared with me, and we helped her. So that is important.
Yeah, it sounds like, we've kind of moved past doctors being the ultimate authority and the patient just following their lead. And now we're looking more towards the benefits of a patient being a partner in their care and treating their appointments like they need to keep you in the loop. And especially with so many of us having more than one health issue, we have more than one specialist. A lot of us see like an ophthalmologist, a neuro-ophthalmologist, we might have physiotherapy, occupational therapy. There's like all of these components that NMO patients have to their health. So like a neurologist doesn't handle all those different things. And so when we see them, it sounds like it's really helpful if the patient can kind of fill you in on who they've seen and what the treatment plans were from these other people. maybe some of the tests that they've had, those kinds of things, so that you're all kept in the know of what's happening.
Absolutely. And especially in this time of our technology involved, first of all, if you don't tell some specialist who else they need to copy on the report, I will never receive it. I wouldn't even know this. And even if you tell, believe me, there are human errors, happens all the time. Our technology in different areas don't communicate with each other, and I still may not necessarily receive full information. So it's important for patient to tell me, who else did you see? What is a plan?
And especially because, if you're having any kind of testing done, like MRI, for example, which we have fairly commonly in the NMO community, that's an expensive test and it takes a long time to get. And you don't want to be replicating tests if somebody else has ordered something the same, to have those same things and you have 2 or 3 providers saying, oh, you have this, MRI and you're getting this test booked at 3 different places or, 3 different times, and you really only need one. And some of those tests, like if you're having contrast, you don't want to be exposed to that over and over again unnecessarily.
Yeah, and a good example is if you're working closely with rheumatologists, we will frequently use it in people with NMO. And you want to go to a rheumatologist who knows about NMO, who specialized. It's not necessarily can be the person close to your neurologist. And so communication between different health authorities, between different systems is essential in this situation, because it's like virtual treatment group that working with the same patient. So we all need to know about it. And it's important for me to have an update and know even what is a plan for people.
Yeah, for sure. So some patients bring a friend or a family member to their appointments. What are the benefits of having a loved one present for that?
Well, I think that my preference is that for people to bring family members. However, I want them to be comfortable. Like, I don't want if the family member doesn't want to come and patient drag them, and then in the office they start to argue and try to solve some issues. It's not productive. If our family is supportive, if family needs more education, it's wonderful. This situation, we can work together. What I usually tell people, it's not just a person who has disease, it's whole family who has. It's much easier if you have more people in your team against disease. And there are a lot of information that we're usually sharing with patients during appointments. And it could be very stressful. If you have somebody who can support you during the stress, who can take notes for you, and you can focus on communication, it's also, I think, that's very, very useful. So absolutely, team of the families and friends are welcome if patient feels comfortable with this.
Yeah. And I think you make a good point that it can be stressful, some of these appointments. I know I've taken my best friend to some of mine when I know that I'm not in the frame of mind to do it by myself, just to get that extra bit of support. And what I discovered about myself was that when I'm under stress, sometimes I forget to mention things. And, it might have been something that I discussed with her. And she'll say, oh, hey, do you want to tell your doctor about this or that? And I'm like, oh, yeah, I completely forgot, because when you're in the moment, you don't always remember these things. And especially when you're feeling a little bit stressed about the appointment.
It's true. It's also an important piece for me, what called collateral history. Like, for example, if somebody is complaining that they have memory problems and the significant other can tell that, yes, you do, but it's usually when you're tired. It's totally put different spins on everything. A Mass Society many years ago did an interesting research. They tried to come up with questionnaire about how you can detect if a person has or doesn't have like a memory or cognitive problems. And it was paired with depression and anxiety skills. And what they figure it out, they give the same, when they give the same questionnaire to significant others, they actually can detect and differentiate much better is it depression, anxiety, fatigue, or true cognitive problems. And I totally understand it. We all know after you have sleepless night and you're tired, you can process information fast, but it takes additional effort to recognize this pattern. And if you have supportive family, it's useful, or friends.
Yeah, and I think sometimes your own awareness of those things could not be as good as it might be. And yeah, people will notice like a behavioral change, or, maybe it's different than, oh, I lost my car keys. It's much different when you have memory issues and when you're dealing with a lot of fatigue, and that affects your ability to process things. And I can see, like, to have somebody there to validate that for the doctor to say, yeah, this really is a problem.
Another thing is that people should not worry that physician will take the words of significant others against their own words. It's never happened this way. It's just information for consideration. So if somebody tell, oh, you're really very impulsive, you cannot function well, it's not going to be taken against you at all. So it can be many different reasons. So open communication with everybody, I think it's very important.
What kinds of testing should NMO patients be having? How often and why?
Well, it's a complicated question because I think that people with NMO may have different symptoms. One of the types of the test that we're doing is a test to follow up disease in brain, but it's not all the story. Another thing that what if you have other complications or presentations of NMO, they also need to be followed up. How frequent depend on the course of the disease. I have patients who do extremely well, and I can do, for example, for them MRI once a year, and they don't have any like arthritis or any other rheumatological problems. It's one way of follow-up. Or the other way, if person has more problems and I need to follow up, I definitely will have closer follow-up if I need to change the therapy. And again, we're going to the question number one. So it depends how the person feels, what kind of problem they have, what they're telling me. If they are concerned about any symptoms, I get concerned about it. And then we do more frequent follow-ups and see what else we need to do.
It sounds like communication is key, like letting your doctor know what's happening with you.
And everybody is different, and we should recognize this difference and try to do more like personalized approach as much as we can.
So I wanted to ask about depression. Does NMO cause depression? We know that in MS patients that there can be damage to parts of the brain that affect mood. And so, sometimes people will develop depression as a result of the disease course, but also depression in terms of, just the situation of being chronically ill. So I'm wondering if we know, does NMO cause depression?
Well, my approach to depression is probably very neurological. It's not like psychiatrist. For me, depression and anxiety is a result of some electrolyte imbalance of the brain. When situation around you perfect, brain deals just with one problem, with electrolyte imbalance, and you may not see as many symptoms. When situation changes and people have physical stress, emotional stress, or any other problems, brain need to deal with more than one problem, and then you can start to see the symptoms. NMO, definitely one of these diseases that put a lot of stress on the people, and people may have depression dealing with serious problems. Does it affect people on this electrolyte imbalance? We're not yet on the level that we can determine it definitively for each person because there are many electrolytes in the brain.
And is this something that neurologists are routinely screening for?
Different clinics do things differently way, and it strongly depends on resources that you have. In our clinic, we do have a depression scales that we do it quite regularly for people. But again, it's all triggered with communication. If person denies any depression, doesn't want to do the scale of depression, I may not recognize it. But we encourage people to do it regularly, to screen it.
And how can a patient broach that subject with their neurologist? What kind of advice can you give around that?
Well, it can be very open communication. And if you tell me that I feel sad frequently, it's enough to trigger already attention to the situation. I do ask people, do you feel sad or happy most of the time? Do you feel that you take longer for you to process information than before, to see if there is some cognitive issue? But cognitive issues can be from depression. So some of the physicians, maybe because of the lack of the time or lack of resources, they may not ask this question. And it will be extremely beneficial if patient will mention it in their list of the issues. I feel sad. I feel anxious. It's difficult for me to fall asleep because I cannot relax. It will trigger totally different pathway and will bring additional specialists in the loop. And it will be very beneficial.
I know some clinics have what they call a neuropsychologist. Can you just explain what that is, what the difference is between a regular psychologist and a neuropsychologist?
Well, I think that it's a major difference between them because regular psychology, they can do a lot of counseling for you, like let's say on marital issues or on something else. Neuropsychologists, they play dual role. The most important role for them actually is mapping the brain with psychological tests and see which part of the brain not functioning as well as they're supposed to do for this specific patient. Like, for example, if somebody has IQ, let's say 120, but they map and they see that some of your memory is just 95. It's a bit lower for this person. So that is very useful. It's useful information. From practical standpoint, what they can do, I think that many of them focus only on the testing. They don't do as much counseling. And again, in Canada, a very few clinics have these benefits of having neuropsychology. Some of them do a lot of research, which is good, but we have extremely limited access to this service, unfortunately. And then why you need whole team of psychiatrists, psychologists, social worker, and probably occupational therapists. I actually found that occupational therapists are very useful in this situation. They do a lot of cognitive tests, maybe like on the lower level, on the basic level, but they also can teach a lot of tips how to deal with many things. They're very practical people.
Yeah. And just for our listeners, can you explain what an occupational therapist is? Because a lot of people misunderstand the word occupational and think it's somebody that helps you get a job.
No.
And that's not the case.
Not the case. So I like how rehabilitation physicians see it. So the first level of care, if you know what's causing disease and you can treat it and get rid of it, and person functioning perfectly well. The second level is you cannot treat disease completely. Person have still some symptoms, for example, fatigue or lack weakness. In this situation, you're getting physiotherapist who will try to compensate for the symptoms. Then the third level you did already and helped a lot of the things with physiotherapists, but person cannot function. So for example, with leg weakness, they put something on brace, but person still unable to walk. So occupational therapist is the person who explains how to function with current limitations and how to function well.
That's a great explanation. Some neurology clinics offer collaborative care, seamless, effective, and efficient care that addresses a spectrum of the patient's health needs by a team within the clinical setting. Can you share with us a little bit about who works with you in your clinic and how this setup helps your patients?
Well, we change over the years trying to find the most efficient way. And we collaborated. So we have like different model. We have core clinic, which includes neurologists, which includes nurses, which also includes research team. Then we have mental team that we collaborate with all mental health teams around our region. So we can refer patient there and they take over. And we have rehabilitation team, the rehabilitation physicians, one of them in our clinic, one of them outside of the clinic, and they have access to all health units. So it's kind of blended model of core clinic extending into community and being it close to patient home. And that's what I feel very beneficial when you do this care close to patient home.
Yeah. And just the fact that you can get a lot of your healthcare within one setting and not having to run around, especially when you're not well, trying to get your healthcare piecemeal. I mean, that makes sometimes the difference between coping and not coping.
And it should be centered around the patient because everybody's need different care and you can get different healthcare practitioner to get involved in your individualized patient care.
And what role do neurology nurses play in patient care?
Well, I think that they're critical. the first contact for the patient. They can easily and should easily to triage patients who need to see neurologist immediately, who needs to do, for example, some blood tests, who need to see a rehab physician urgently, or they can give some advice what can be done to alleviate some symptoms. It's critical to have experienced nurses.
Yeah, it sounds like they're a great resource and link for just between the patient and the neurologist as well. So is there anything that you feel that you'd like to add that I might not have addressed?
Well, I can email you later on about importance of the nurses. It's actually nurses who develop essential MS tips for preparing for televisit. It was collaboration of the nurses of Canada and nurses from our clinic were one of the leaders in this. And I think it's very well written, and it's a very good idea to share it with everybody. Because is it MS or an NMO? It's still very similar approach. Just NMO, a little bit more complex. You have a little bit more team members involved.
Well, I want to thank you so much for taking the time out of your busy schedule. I know that things are just crazy in your life right now, and I just really appreciate your time and your attention and just your willingness to come and share with our listeners today, how they can get the most out of their appointments with their neurologist. I think you've given us some really concrete information about what we can do to open up the lines of communication between us and our neurologists so that we can help ensure that we can get the best care possible. So thank you so much for that.
Thank you very, very much for inviting me. And I hope that it will help patients with NMO to navigate our healthcare system.
Thank you.
We hope you have enjoyed listening to this NMOSD Your Way Global podcast. For more information about NMOSD and access to support and resources, please read the podcast description. What you have heard in this podcast may not be reflective of your own experience and does not replace the advice of a healthcare professional. If you have any concerns or specific questions about NMOSD, please speak to your physician.